right. First and foremost, it's a very good afternoon to you. Thank you very much for inviting me. I must thank the JMFOA 2014 for inviting me for these sessions, and especially Dr. Satyalingam, who was also one of our trainees, for inviting me here. My topic today is National Program on CPR, BLS, and ALS. Now, we will not be able to talk about a national program if we don't go back to history. Now, the history is before the 1990s, we didn't have any formalized program, leave alone anywhere else in the country, not even in Colombo. One of the pioneers was Dr. A.T.W.P. Jayawardena, or Dr. Thisal Jayawardena, as he's very well known, who was the first intensivist in Sri Lanka, and who was the consultant anesthetist in the cardiothoracic unit at the then General Hospital of Colombo, now the National Hospital, Sri Lanka. And he, whenever a medical student, nurse, trainees, doctors used to come under his wing, he used to emphasize the need for this. And I think it was very important in his unit because cardiac surgeries were being done, how important it was. And he used to, train each and every one of them on BLS and ALS. And so it was really an individual interest. We didn't have any regular workshops. Of course, he was very well sought after by all the other colleges when they had their sessions for organizing these workshops as part of their sessions. Now, if you look at the global picture, the Resuscitation Council of UK was formed in August 1981. For you all, it must be very ancient. For me, it's not, because that's the year that I passed out. And the European Resuscitation Council was in 1989, was formed in 1989. And then, of course, in the year 2000, the International Liaison Committee on Resuscitation laid down guidelines. And then they decided that hereafter they should have every 5 years all the parties involved in resuscitation should get together, look at the statistics that are there, see how many things that were done in the right manner. If something was not, if they thought that the evidence was against it, they wanted to change it so that there was uniformity. And this resulted in International Consensus Conference on Emergency Cardiovascular Care and Cardiopulmonary Resuscitation, Science with Treatment, to have guidelines laid down every 5 years. So we had the second set of guidelines after 2000 in 2005, and the third set in 2010, and it is the 2010 guidelines that we now practice. And so this year they'll be sitting again, and then we will have a new set of guidelines in 2015 after having looked at the evidence to see whether we need to change anything. So going back to our program in Sri Lanka, we started a regular formalized program in the accident service of the then General Hospital, Colombo, in 1993 in both BLS and ALS. The participants were doctors, medical students, nurses, armed forces, health workers, and so on. And then we met Professor Sharif Dean, who was the professor of surgery at the time, and wanted him to get all the medical students to undergo this program so that when they finished their accident service appointment, they were certified in BLS and ALS. Then, of course, we also decided that if we put it as a postgraduate trainees, a component of their syllabus, then that will also make all the consultants who come out be very familiar with it, at least in anesthetics. I mean, we are only able to do it in anesthetics because my specialty is in anesthesia. And so we made it part of the viva voce examination in the MD Part 1A. And then, of course, we decided we can only spend about 10 minutes questioning them on CPR. So we made it a prerequisite to sit the Part 1A examination so that there can be detailed assessment before we certify somebody as being capable of functioning as a member of a good resuscitation team. And then, of course, they were certified by the consultants who did this training as being competent. Then the College of Anesthesiologists of Sri Lanka decided, now that it had become a prerequisite for the Part 1A examination, and since they were running a course for the Part 1A anesthesiology, that they should have it as part of the course. So the course winded up with a workshop, with a one-day workshop on in both BLS and ALS, and of course there was no way of certifying. I mean, the training was given, and then, they were not examined to see whether they were okay, but certified as to be able to apply for the exam. Now, coming back to this CPR program, which we were conducting at the National Hospital, this was on a weekly basis, every Tuesday at 9 a.m., like a prayer it went on, both BLS and ALS, and was conducted by a consultant anesthetist initially. Of course, when the workload was very heavy in the neurosurgical unit, I gave it to the senior registrars to conduct. So the program was like, we had an introduction to show how important this BLS and ALS, and how easy it is to resuscitate a patient who can be resuscitated. And then, of course, we did basic life support, advanced life support, and hands-on training on a mannequin, and then allowed them to practice on the mannequin thereafter. Of course, there was no formal certification again. But in year 2004, we decided to improve on the program, and then we decided that hereafter, we will be questioning them on the new guidelines that are laid out, so that everybody knows that these guidelines will change from every 5 years. And they will know about these different resuscitation councils. And then they be certified by then they will be issued a certificate from the College of Anesthesiologists. Now, this is what Vasumati said, that I will speak on the requirements for certification. So what we did was, we said that anybody who wants a certificate needs to attend 3 workshops on 3 Tuesdays. The 4th Tuesday, anyhow, we didn't have the workshop, but we had the exam. And this exam consisted of 40 MCQs, true-false variety, and they needed to obtain 75% of marks to go on to the practical part of it. So once the ones who got more than 75% of the marks then were allowed to go for the practical component, which was scenario-based, individualized for that person's specialty. For instance, if it was a GP who was coming, then we enacted a scenario in his GP surgery, that kind of thing. And what we really tested was, of course, the same things: external chest compressions, ambu ventilation, maintaining the airway, and defibrillation. They needed to pass the practical exam if they were to be certified. That means if the College of Anesthesiologists was to issue the certificate. Then in 2010, we thought, just like UK having their own resuscitation council, why not we have a National Resuscitation Council? And our vision was to reduce the morbidity and mortality of the critically ill, and towards achieving this vision, our mission was to ensure early and effective resuscitation of any patient who needs resuscitation. And the council was to be established so that we could set the guidelines, then run the similar courses and workshops throughout the country, certify them, and also for research purposes, document every case that was resuscitated by the team, and then go through these on a regular basis, just like what the International Liaison Committee was doing, and then see where we had gone wrong, and then maybe we could become, our long-term goal was to become part of that International Liaison Committee. So towards this end, we formulated a working committee on resuscitation in the year 2012. As I told you, the objectives were to promote research in the field of resuscitation, conduct CPR training programs, promote public awareness, promote collaboration with different organizations, and we managed to get collaboration with the European Resuscitation Council. So the College of Anesthesiologists of Sri Lanka has signed a course collaboration agreement with the European Resuscitation Council to conduct advanced life support provider courses and generic instructor courses in July 2013. And the CPR courses will be held, we are trying to hold it throughout the country. And you can see the places where we have selected right at the beginning. It will be the College of Anesthesiologists, National Hospital of Sri Lanka, Teaching Hospital Karapitiya, North Colombo Teaching Hospital Kandy, Teaching Hospital Jaffna, Sri Jawadanapura General Hospital, and Hambantota. And the course organizers are these doctors. For Jaffna, we have Dr. Vasumati Devanesan. Now, the first course with the ERC will be held in November 2004, and then this will be followed by instructor course on the 4th and 5th of November. So what is our future goal? Our future goal is to have accreditation, accredited course by the European Resuscitation Council to be conducted throughout Sri Lanka, and once we've done that, for us to apply for the Asian Resuscitation Council and then maybe to the International Liaison Committee if we have enough. Our problem always is data. Nobody keeps records, nobody bothered about writing, and you can't blame anybody but this country because we have so much of workload. The workload that is being handled by 10, 20 consultants in another country is handled by 2 or 3 here. So that's what Vasumati was trying to say. So for us to have adequate trainers and to certify them so that we will have an effective world-recognized resuscitation program, which I think the college now has spent a lot of money and thinks is needed if we are to move forward. So with this aim, our goal is to ensure early access, early CPR, early defibrillation, early ACLS to every individual in this country, in any corner of the country, so that if the patient can be resuscitated, that patient should have the right to be able to be resuscitated by a competent team, so that as everybody has the right to live. Thank you.